Awakening. Part 4. That concludes our meeting. Please review the information again on your own. We should just move on to the surgical conference now, to save time. Those doctors involved, please stick around. Am I not involved in this? We're starting, Doctor. Dr. Styles, pay attention. Can I cast a sorrow in her and, you know, I don't know, send her to wherever? To Anime Land? Well, I think I am in Anime Land. Shit! Huh? What? Oh, sorry. I guess I didn't hear you. Yeah, I was being possessed by Satan. I'm sorry. Is everything all right? You've been staring at that X-ray for a long time. I was just going over today's operation again in my mind. Anyway, let's get the conference. Let's get the conference started, huh? Yeah, this music definitely sounds like a Persona game. Definitely. He's been spacing out a lot lately. At least he's concentrating hard on something, I guess. Mario Kovac. Multiple aneurysms have formed on the surface of the large intestine. Requires sedative treatment and suturing of affected vessels. Today's patient is Mr. Kovac, who was carried in this morning. He's currently not doing very well. Tests showed a number of aneurysms near his large intestine. Some of them have ruptured, and there is a risk of anemia. We need to perform a laparotomy. A laparotomy? I've heard this word before. Why am I having problems? And get those aneurysm under control. The objective of this operation is treat the aneurysm of the outer membrane of the patient's large intestine. That should be all. First, inject a sedative into the swollen vessel to reduce its size. Excise the problem area and saturate the vessel closed. You'll need to use magnification again to ensure your accuracy. Derek, concentrate on the patient. Don't worry about anything else. Okay. Let's begin the operation. Let's begin the operation. I need to cut him open, absorb something. Yeah. The antihypertensive is in effect, but the aneurysm could still burst. We need to hurry, Dr. Styles. Okay, cut.
Doctor?
The lump on that vessel is in the aneurysm. Try magnifying that area. We're treating an artery. So be careful.
Be careful.
Let's try to avoid the rupture. Inject the sedative into the aneurysm. Injected.
Well done.
Okay. And then cut it on. It should decrease the risk of it rupturing.
Doctor.
Ah. So I have to be fast. I was reading.
Now's your chance.
Excision complete. Now place it on the tray.
Doctor.
We have to reconnect the vessels that were cut. But there's a lot of blood in the way. Drain the blood first.
Then forceps.
The vessels area is clear. Now perform anastomosis. Yeah, these are definitely new words. You'll need to manually connect the one side to another. Oh. How do I connect them? With this?
Doctor!
No, definitely not like this.
Doctor!
Forceps?
Please be careful, Doctor.
I think it's with the forceps, right?
Doctor!
Okay, I shouldn't actually. All right, should have not, you know. I just should have connected and now release it. The vessel is connected. Now saturate quickly.
Good work.
I think that will do it. The aneurysm's been treated. We can finally relax. Let's close him up now. Cease magnification. What? Again? Every vessel in the area is in danger of becoming an aneurysm. Continue the operation. We'll just have to treat them all. Oh, another one? So I need to, and then pick it up. Clear the blood.
Forceps.
Then... That's it. Oh, another.
Use the Doctor!
I need to magnify.
Doctor!
What? They burst. Okay. I didn't even do anything. Like, they just bursted. They did their job to me. I mean, it did its job. And then,
Well done.
magnify and magnify in. And then,
Doctor!
no. And then pick it up. And then,
Vitals dropping.
and then suture it. Good work. I think it's settled down for the time being. We should wait a moment to be safe before we close him up.
This isn't
What
good.
the shit?
Maybe your ability.
Oh shit! I think, yeah, that's where I need to actually use it, huh? Oh. I don't need to do that, actually.
Not much time left.
I need to suck
Use the
all that blood.
magnification.
Ah, shit. Yeah, I'm doing really bad, by the way, viewers. And...
Please be careful. Please be careful, Doctor.
the patient seems to be able, seems stable now. This procedure is complete. Let's close him up, doctor. I didn't even use, I didn't even use my ability. Pick this.
Nice work, Dr. Styles.
Another operation complete. Great work, Dr. Styles. Yeah, I didn't do anything. I should have, I think I should have used my ability here, but, I don't know. I didn't need it. 2 cools earned. Yeah. Yeah. C. A C for capable enough doctor. Yeah. So I understand you figured out how to control the healing. If you say so. Make sure you don't rely on it too much. I'm trying not to. Actually, no. I'm not trying not to use it, but I don't think I don't think I needed to use it in that operation. You need to develop your basic skills too. Huh. What the? I know it won't be easy, but you didn't take this job because... Everything's going black. Derek, are you even listening? Derek, what's wrong? What? Did I pass out? What the hell happened? Huh. Part 5. Paying the price. I just dropped dead? Well, rest in peace. I'm dead. That's it, viewers. Game over. Game over. Forget about that power. But Are you prepared for the pain that would bring you? I became a doctor so that I could help people. And if it's cost you your life, you'd give up your own happiness? Oh, hell no. I'm not gonna give up my own happiness. I don't know, but I do know that people need my help. And I want to help them. Whoop. Chew, chew, chew. Where are we? Huh? Where am I? You're in am I in heaven? Definitely not in heaven if you're hearing Persona music. You're definitely in hell. Oh no! I'm gonna play Persona 3 for the rest of my life. Oh Lord, am I in hell? Yeah. I'm sorry that I'm triggering. I'm sorry if I'm triggering, you know, Persona fans about it. It's the ceiling. What am I doing here? Dr. Styles! Angie? What happened? After Mr. Kovacs' surgery, you just collapsed. You've been asleep for 3 days. For 3 motherfucking days? What? 3 days? What about my patients? I have operations scheduled. Already taken care of, Derek. I called in the other doctors. But that's in the past. We need to discuss how you're going to proceed from here. Okay. Derek, I forbid you from using the healing touch like that. I didn't use it! Well, I kinda practice it. Kinda. But why would you... That ability puts a tremendous amount of physical strain on your body. It is too risky. What if you collapsed in the middle of a procedure? But without my healing touch, Mr. Kovac might have died. No. Nah. That's not true. Exactly. That is why you mustn't abandon the healing touch. I'd advise you to use it only when absolutely necessary. After all, you shouldn't be relying solely on the healing touch anyway. I mean, yeah, I guess I paid for, or someone paid for my medical training and medical education. Developing your natural skills as a surgeon is far more important. We can't assume the healing touch was the only reason Kovacs survived. If you want to help people, then focus on strengthening your natural abilities. I understand. Take it slowly. I am sure the power inside you will find its way out. Become the best surgeon you can, and one day you'll inherit the full heritage of Asclepius. Yes, sir. Asclepius, 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 Asclepius. Just let me die. What? Excuse me? Why? Part 6. Uh-oh. Danger music. Danger, danger! Oh shit! Doctor! An emergency patient was just carried in. Vitals at 60. CS is 300. I have no idea what that means. She's in shock and losing blood fast. Call the rest of the staff. We need to operate immediately. Angie, get the patients in the OR. Derek, you handle the surgery. I'm on it. Linda Reed. She's kind of short. Several bleeding lacerations found in the right lung. Oh no. Patient's vitals are unstable, necessitating extreme caution. The patient is a 17-year-old female. Her case history is unknown. We found a massive bleeding in her thoracic cavity. Derek, you need to perform a lobectomy immediately. This operation has one objective: treat all injuries within the thoracic cavity. We'll proceed from there. Drain the blood first. If it's a large laceration, large laceration. After that, use the forceps to close the area, then suture it. Just be sure to drain any blood before moving on with the operation. Hurry, Derek. Let's begin the operation. Alright. Let's save the waifu. Well, she's 17, so she's not... Oh shit, they already covered her titties? Nice. I'm not gonna get banned. Alright. Let's do this fast. What? How could something like this happen? But there aren't any external wounds. This isn't possible. No, it doesn't matter what caused it. We need to focus on stopping that bleeding. Understood, doctor. Let's begin treating her. I wanted to do this. And then...
Doctor.
These are awful. Trying to suture them would be far too dangerous. Try using forceps to close the wounds before you start suturing. I'll need to drain all the blood first, and then forceps.
Doctor!
Ouch.
Vitals dropping. Doctor!
It opened. Oh yeah, I definitely need to do the healing touch here. You can't handle this. Get out of my way. Shit. Yeah, I definitely need to use the healing touch here.
Let's get started.
How do I do that again?
There isn't much time. What the? Doctor? Vitals dropping. Doctor!
I did the thing! I did the thing! I did the thing! I probably needed more practice with that. I needed more practice with the ability. I don't know how to summon Satan. Alright.
There isn't much time.
Let's do it fast.
What the? Doctor? Vitals dropping.
It's not working. It's definitely not working. It's definitely not working. Retry. It's definitely not working. I don't know why. It's probably scripted.
Let's get started.
So yeah, let's try our best. Let's try our best. I'm gonna focus on one wound.
There isn't much time.
Ouch! I'm sorry.
What the? Doctor?
So forceps, and then
Vitals drop. Good work.
and then drain, forceps, And then...
Doctor,
And then, I think... These are also with the forceps? No, I don't think I need the forceps for this. Yeah, I didn't need to summon Satan. Close up the patient. That's it. And then...
nice work, Dr. Styles.
That's it. Why? I had the skip button and initiated all that time? God damn it. I didn't need to summon Satan. Max chain over 10, less than 2 hemorrhages. Wound did not reopen. Why? I think I did great here. Oh shit! Senior surgeon, I got an A? What's the highest rank? What's the highest rank? Is it A? Is it A? I don't think it's A, but... Shit, I'm too good. Where and what did those injuries come from? Are we getting actually some interesting story elements here? I don't know. It'll probably take some time to figure out. She'll be hospitalized for a few days, so let's try to keep an eye on her. Did you notice those cuts along the girl's wrists? Yeah, they looked recent. Oh god, is she emo? Is she a drug addict? Is she a heroin addict? I'd say her real illness is deeper than we thought. If that's the case, I don't think we're finished seeing complications. Hey! Part 7. Reasons why. Damn, I'm sorry I missed on some of the story elements, by the way, viewers. I didn't notice that till actually the skip. You have to toggle off the skip ability. Feels bad, man. Hope Hospital, room 201. Is that the room that I was in? Oh shit! Get away! I never asked you to save me. Leave me alone. Oh my god, she's an emo. Don't worry, I can cast you back with my back to hell with my satanic powers. Just say so. Please calm down, Miss Reed. It's all right. When I passed out, I could feel it. My chest was on fire. I was finally going to be free. Oh god, she actually wants the sweet release. Why did you bring me back? I didn't want to live. Why would you want to die? You're still young. You have your whole life ahead of me. Yeah, there's something to look forward to, huh? How come everyone says that? My life sucks. Oh god. I'm tired of all this pain. I'm not pretty enough to date the popular guys. I'm too fat. Excuse me? Are you... is she Korean? I think Korean are the, mostly Asian women. There are, like in China and Korea, there are what do you call it in English? They're self-conscious about their, their weight. My mom called me a failure yesterday because I might not even graduate. Shit, that sucks. Is that a life you'd want? I'm never going to be happy. It all depends on my attitude. What a joke. A positive outlook won't just magically solve all my problems. Can I slap her? How can you slap a little bitch with the Wiimote? Wow, Angie, calm the hell down. Holy, dudes, what's wrong with you? There are patients here who have to fight just to breathe properly. Every day, someone dies after a long and painful struggle to hold on. I'm sorry we saved you. Go into your life. For all I care. Holy hell, Angie. Angie! I know you did your best, Doctor, but I'm afraid it was wasted effort. Stop talking like that, Angie. I have other things to attend to. Alright, I'm liking this game a lot. I'm liking Angie a lot, actually, too. I'm sorry you had to waste your time operating on me. Helping someone is never a waste of time. Just leave me alone. I don't blame that nurse for hating me. I hate me too. Oh. I'm not going anywhere. You're still sick? What kind of surgeon are you then? I thought you fixed me. It's not that kind of sickness. A doctor's job is about more than physical illness. And Nurse Angie taught me that. Oh, really? Now we're learning from nurses? A surgeon? Learning from a nurse? Ha! Ha! I have my satanic powers. I don't need that bitch. When I was little, I had a cat named Tama. We were playing one day and he ran out into the street. Oh shit. I wasn't fast enough to do anything. A car hit him and I blamed myself. I decided it was my fault Tama died. Well, it's kinda is. I really thought I had killed my cat. It was all I could think about. By mean that it actually is your fault, I mean that animals is the responsibility of the ones who take care of them. If something happened to the animal, so yeah, it's mostly the responsibility. You know, the cause of that is mostly the one who take care of them. That's why I don't like, you know, taking care of animals. Although I think dogs are cool. It was all I could think about. I told my mother I did a terrible thing, and I wanted to die. Shit. Because of a cat? Come on. Cat people, please. What happened then? She slapped me hard. She did good parenting on you? Well, props to your mama. Props to your mama. Mom told me Tama would be ashamed of me, and that she was too. But she also said that I was the one who should be most ashamed of myself. She said that to you? Who'd you grow up with, Linda? Huh? Do you have any siblings? Or what about pets? Just my parents and my friends at school, I guess. Could you look those people in the eye and tell them you wanted to die? No way, of course not. That's why I want to be left alone. Then hold this. A mirror? Look at that girl. Look at that girl there and say, I want to die. I want to... I couldn't do it either. You couldn't do it either? What? You actually thought about dying? Well, he's kinda did want to die because of a cat. Cat people. Please. Now tell her you're sorry. I think she deserves an apology. I'm sorry. I'm sorry. I'm so sorry. Stop worrying about other people and start making that girl happy. Don't work hard in school for your mom's sake. Do it because you'll learn more and become a better person. Don't let other people decide whether or not you're happy. Even if your educational system is actually trash. Well, I assume they live in the US, right? So then yeah. Your education system, viewers from the United States, it's kind of trash. So I've heard. Find things you enjoy and do them, like dropping out of school. It might not make you popular, but you'll like yourself a lot more. And you aren't too fat. I've seen your charts, remember? Your mother sounds like a smart lady. Really? She could be pretty weird sometimes. But then she'd say, I may be weird, But think of all of the stories you'll have to tell one day. That's interesting. Cough, cough. Oh shit, she's gonna die. She's gonna die now after wanting to actually live and graduate school. Ah, sorry. I guess I got a little carried away. Really though, she's great. I should let you rest now. I think I'm going to take a nap. That's a good idea. Sorry for talking so much. Next time I'll thank you. You're a good doctor. Damn, more lore, huh? More cutscenes. Reconciliation, Part 8.